In this video you will learn how to fix one of the main causes for sciatica pain, and that is bulged disc. So buckle up your seatbelts and let's go! What's up, ladies and gentlemen, my name is PT Philip. My goal is to help you enhance your performance. And when it comes to sciatica, believe it or not, 40% of US population suffers from this injury, and the back pain comes in all shapes and forms. If you really want to learn how to permanently fix back pain, go over here and check out this video. But today we're going to talk about sciatica. Now, sciatica is referred to any and every lower back pain, but the causes of this lower back pain can be plenty. The causes can be the stenosis, the inflammation in the SI joint, the bulged disc, the pinched nerve, the tightness of piriformis muscle, and basically the causes of sciatica. They can be so many, and today I cannot cover all of them. For that you will definitely need to visit your physical therapist, and then he can do different tests and he can really specify what is the main cause of your problem. But today we're going to talk about bulged disc, the most common cause of sciatica pain. But before that, what the hell is sciatic nerve and why it causes so much pain for so many people? Well, the sciatic nerve has 5 roots. The 2 roots come from the lower back and 3 come from the sacrum. And basically, these roots, they form a big nerve that runs all the way from your lower back to somewhere behind your knee, and then it branches out further. This nerve is the thickest and the biggest nerve in our bodies, and the direct injury to the nerve itself is not very common. So basically any lower back injuries and pain that you have in the lower back, all the way through the buttocks, through the hamstrings, and if the pain goes down in the leg, we call that sciatica pain. Usually stiffness, tightness, and pinched nerve causes the pain to occur in the first place. Today we're going to talk about bulged disc. So in between your vertebrae, in between your spine, we have discs. Those discs absorb pressure, and basically they allow your body to move in 3D dimension. Without this disc, your moves would be very rough and you wouldn't be able to perform such fine movements. When it comes to these discs, imagine a jelly donut out of them, and they are in between 2 vertebrae. And basically, when those vertebrae, when they move, that jelly donut allows them to not have that friction in between them and allows them to move smoothly. Now, if you perform a certain move with bad form, with bad technique, what can happen? Well, the jelly donut can squeeze out, and that's when you get the bulged disc. Why does that happen? Well, because people don't know how to do basic normal activities and like bending forward, and pretty much every activity we do requires us to lean forward in some way, shape or form, and the goal when the bulged disc occur is to return it back. So if we went into flexion and then the bulged disc happened, the way to fix it is to turn our body and our spine back into extension. And today I'm going to show you an exercise progression that you can do in the comfort of your own home. And this exercise progression will be focused to basically centralize the pain in the lower back. So while doing these exercises, the goal is to get the pain out from your leg and into the lower back, because when the pain is centralized, then it's much easier for you to treat it afterwards. And one thing before we start, if any of these exercises causes more pain, then probably bulged disc is not the main cause of your sciatica, and I would definitely advise you to go see a physical therapist and a doctor. So with that said, these exercises, if you're not experiencing extreme sciatica pain, might feel a little bit too easy and too simple, but trust me, this exercise progression is doing exactly what needs to be done to your spine. So the first thing, we need to get you in a pronated position. You need to lie on your stomach. And if you have back pain, it's not going to be that easy if you have sciatica pain. So the first thing you can do is you can put a pillow underneath your belly like this, and then you can lie right here. And I don't want you to perform any of these exercises if you have pain while lying on a pillow like this for a longer period of time. All right, so after you get comfortable in this position right here, then you can remove the pillow. You can remove the pillow, and then you can lie on your stomach like this without anything underneath it. So when we are in this position, our spine has natural curves, as we all know, and basically already in this position our spine is in a little lumbar spine specifically is in a little extension, and that's exactly where you want to be. And again, I don't want you to feel any pain in this position. So if you feel any pain, get out of it, but try to hold this position for as long as possible, and really try to move that pain threshold while holding this position. To get your lower back into a bigger extension, now the next progression we can do is that we can get on our elbows. So you're going to slowly have your elbows right here next to your body, and then you're going to raise your upper body, but the entire surface of your forearm is still going to be on the floor right here. And again, we are going into a bigger and bigger extension in your spine. And now I want you to go into this position, hold it for anywhere from 3 to 5 seconds, get back, relax your muscles for another 3 to 5 seconds, and then repeat. And breathe throughout the entire exercise. Don't forget to breathe, and perform this one for at least 10 reps, all right? After a while, when this exercise gets comfortable, now the next progression you can do is that obviously you can go on your arms, and you're gonna put your arms right here next to your body, but I don't want you to extend your elbows fully, so have the elbows bent a little bit, push off the arms, use those triceps, and you're gonna go up as far as you can, hold it for 3 to 5 seconds, go back down, rest for 3 to 5 seconds, and repeat for at least 10 times. The next progression after this one, when you get comfortable doing this one, is obviously going to be the same thing, the full cobra stretch, but with the elbows fully extended. So I'm going to repeat the same exercise again, and I'm going to extend my elbows fully. And while doing this, I don't want your hips to go off the floor or like this. I want your hips to stay on the floor, all right? So hips are on the floor, and I'm fully extended, and my back is in full extension. Again, I'm holding this position for anywhere from 3 to 5 seconds. I'm repeating this one for 10 times. All right? Nice. All right. After you manage to do all of these progressions on the floor, the last progression you can do will be on your feet. If you watched any of my 5-minute full body stretches, you know this one. This exercise is one of my favorite exercises, favorite stretches of all time. So we're going to do full spine extension while being on our feet. And the way you're going to perform this exercise is you're going to make a knuckle out of your fists. You're going to stab yourself in the lower back, but of course gently, so don't be harsh on yourself. And now you're going to press forward with the knuckles, and you're going to slowly breathe out the air, and you're going to go into extension. And get right here and hold this position for 3 to 5 seconds. Once again, get out of it, shake it out a little bit, and then repeat. When performing these exercises and these stretches, at the beginning, you will definitely feel a little bit tighter, but as you progress through them, you will really feel the decrease in pain, especially in your buttocks and in your legs. And that's exactly what you want to do. As I told you, you'll want to centralize that pain, so it will be much easier to treat it afterwards. All right, ladies and gentlemen, that pretty much wraps up this little exercise progression for your sciatica pain. As I told you, there are many causes of sciatica pain, so it's really hard to specify one thing, but this bulge disc issue is one of the most common causes of sciatica pain, and I'm really hoping that this video was helpful. If it was, give it a like button. Once again, my name is PT Philip, and I'm hoping I left you better than I found you. I'll see you at the next video. Take care. Bye-bye.